D135, Chapter 12, Respiratory System, Part 2. Breaking the chapter up into chunks. This part talks about the physiology of the respiratory system. This one is more about the mechanics of taking a breath. And it talks about the syringe analogy. If you have just a syringe and you pull the plunger down and you push the plunger up with your hand, it sucks in or pushes out air. So how does our body do that? How does it inspire and expire? Well, there is some videos on YouTube, which I have in links, which sort of show you the basics visually so that you can see how our muscle, the diaphragm, helps us to expand the volume, therefore lower the pressure of our lungs, and then increase the pressure in our lungs by pushing up and therefore forcing the air out, as well as atmospheric pressure, of course. But this is the mechanics, the physical mechanics, and how our intercostal muscles work. So read that part of the chapter, look at the YouTube video in links called The Mechanics of Taking a Breath, and that will help you visualize how we breathe and how we get air into and out of our lungs. The disease point on page 472 talks about pneumothorax and hemothorax, and pretty much that is getting fluid in between the pleural membranes, or sometimes even a complete puncture through into the lung. But it's if we get liquid or blood, hemothorax, in between that pleural cavity, and the ramifications that we can have of that, and that can cause clots, pain. It's very hard until that pleural membrane heals. The next part of this is talking about measurement of pulmonary function. How do we know whether we have a good or bad pulmonary function? And there's two things here it mentions in the chapter. It talks about spirometry, which uses a spirometer. A meter is something that measures. Spirometry is the process of measuring. So table 12.1 actually talks about the lung volumes and capacities, the types of things that we measure when we're using a spirometer. And the picture in the book here shows a little kid doing a spirometry test. So the main one that we usually are concerned with initially is vital capacity. Vital capacity is the total maximum amount of air that the system can move. Okay, we also have a residual in there which we never fully get rid of. No matter how much we breathe out and keep breathing out until we can breathe out no more, we will always have air in our lungs. So the vital capacity is how much we can push out and how much we can pull in. But there is always a reserve to add on to that, which is our total lung capacity. But our vital capacity is how much we can pull in and push out. The volumes, those capacities change as we age. They change with our gender. They're different between men and women. Our physical size, how tall we are, and of course our physical condition. It also mentions compliance is another way of measuring for COPD, which is chronic obstructive pulmonary disorders, which include a lot of diseases in that range. But it's not used so much anymore. It used to measure the elasticity of lungs and thorax, but it's no longer really used because spirometry, along with things like medical imaging, MRIs, CT scans, and real-time type of echocardio equipment, radiography, Doppler systems, we can actually see lungs a lot better now rather than relying on compliance testing. So once you read that title of this slide, you'll probably have that song in your head. But what is air actually composed of? And it talks about the composition of air. What exactly is it that we breathe in? Air in the atmosphere is made of nitrogen, oxygen, carbon dioxide, and often water. Depends on the humidity, depends on where you are, and each amount again depends on where you are. But this is trying to simplify what it's talking about in the book, but it's expressed in terms of pressure it exerts. So the atmospheric gases, the atmospheric pressure is 760 millimeters of mercury. Okay, now it's measured that way because that was the old way of measuring pressure. And it depends on the day and where you are on the globe. So even in Denver, the atmospheric pressures can change slightly, but we're saying an average is 760 millimeters of mercury. Partial pressure is the part each of those gases plays towards the total pressure. So that makes sense, right? So if our total atmospheric pressure for the day is 760 millimeters of mercury, then nitrogen is typically 78.6% of that, oxygen is 20.9% of that, and carbon dioxide is 0.04% of that. Now, when you see on the weather and you see in meteorologists' studies, some of that can change sometimes. Our air quality can be low, as we know, we've heard that before, and that depends on how much dust and other stuff is in there, which might reduce one of those gases ever so slightly. And of course the water vapor, that changes regularly, and it changes, we have really no humidity here, but if you go to Florida or the East Coast, we get higher humidity, so that plays a part in the total atmospheric pressure and how much part of that is water.